All right, so let's get started. Any questions up to now after lunch? No. Okay. Raymond Hood has a hand
I'll
up.
have just 10 seconds with the French people, and I'll be
Yes.
back.
Oh,
Très bien. Oui, Raymond, je t'entends très bien. Merci, merci beaucoup, Claude.
You can carry on, Avi.
I can carry on.
It's not with the French people. They can hear me
Everything's
well.
good. Okay. I no, someone had their hand up, so I didn't know if they wanted to ask a question. We're good. Okay, fine. No other questions, then we will move on to the lungs. So let me get the slides up. All right. And okay. So we have the lungs, again, reflect on the kidney line, but this time they'll reflect on both sides. Now, is it possible that just the right lung will reflect and the left lung won't, or the left lung will and the right one won't? Yes, it's possible. So that's the thing, that if you have just the left, you can't assume from the left kidney line on the chest, you cannot assume that for sure it's cardiac. It might actually be lungs. And it's just that the left one is showing and the right one isn't. And lung 1-2 area, so that's going to be ever so slightly different than the spleen 20. The spleen 20 is a little bit below the one that's cardiac, that shows on the left side. And it also shows on the abdomen, can show on right stomach 26, 27. On the back, you have the bladder 13 area, the lung shoe area, and that can go all the way to, it can go be a little above, a little below, but also it can go all the way to the inner border of the scapula. In other words, it can go to UB42 as well. So don't assume that it has to be only UB13. It's a whole area. And again, just like with cardiac, that area, the rhomboids, ultimately you want to needle and do direct moxa there, because again, that tissue, that's obstructive tissue that's there, is obstructing, is containing, so to speak, the lungs. Okay, so you want greater expandability of the lungs. So you do need to work locally on the back there. So both the heart and the lungs, you do end up at the end working locally. Okay, so lung treatments. So lung 5 and or lung 8. Okay, now lung 8 is considered a little bit more oxygenation point. So the name itself is called rivers and ditches. So it has to do with, like being able to penetrate things. Okay, lung 5 generally is better for the lungs themselves. And actually, I'm going to stop the share for a second so you can see me. All right, so if you want to actually, for the actual chest expansion, for the actual mechanics of the chest, lung 4, about 4 fingers above lung 5. So is the best point for expansion, the actual mechanics of expansion of the intercostal spaces. Okay, we say, you know how the Chinese have a lung 3. They say if you bring your arm up to your nose, well, this is a little different. This is you bring your nose down to the arm, and that's supposed to be the point. Okay, but it's no big deal exactly where it is. Just because people will tell you, oh yes, my chest expands. So you palpate and you find a spot that will do it. Lung 5, okay, so I know that some TCM people take just on the lateral to the tendon, take it a little further away. You'll find something bumpy, puffy there. Taking it right next to the tendon does not do anything for the lungs, in my experience. Also, you can go slightly down and slightly up. In other words, you can go, it doesn't have to be exactly on the crease. It can be a little bit further down and a little bit further up. And that's going to be important with asthma, to find the exact lung 5. So when you're doing liver for lung 5, for example, no big deal. But when you're doing, you know, you're trying to release the chest for asthma kind of thing, or bronchitis or something like that, that's when the exact location of lung 5 is going to be a lot more crucial for you. Okay, now if there's a problem with inhalation, okay, I use kidney 4 and needle it down towards the heel. Okay, if you have a problem with exhalation, use spleen 4. Okay, and remember, it's a chest problem. Don't use spleen 4 if the pulse is very thin and weak, okay, or short. So just some caution around this. Okay, then before we go to the back, we're going to drop down to this trochanter point. So, you know, that's basically gallbladder 29, except this gallbladder 29 is in front of the trochanter. You basically try, or possibly above the trochanter, you're trying to get the space between the leg and the torso. So right now, if you just stand up, just so you can feel it, and just drop the weight into your legs, naturally your chest sinks. Okay, let me just stop the share so you can kind of see me. Okay, so if I'm standing up and all I'm doing is I'm taking my weight and I'm just letting the weight drop into the legs, and naturally the chest sinks. Now, all I'm asking you to do is push your heels down and create a separation between the leg and the torso, and naturally the chest expands. Okay, so
Avi, can you hear me, Avi?
yes, I can.
Okay, because I have some issue with my my earphones. I don't know why.
Oh,
but you can hear me well.
I can hear you. Yes. Did the translation work for that exercise or not? Do we need to do it again?
Oui, Claude, je t'entends très bien.
I'm sorry.
Non, j'ai pas.
You cannot hear me?
Okay, technical problem.
Lise, tu m'entends, toi? Fais un signe de la tête si tu m'entends, Lise. Oops. I'm talking to you, Avi. Am I?
You
Well,
are
I can't
you're
hear
on the
you.
English channel. You're on the English channel. Okay, we're good. So did the exercise get translated with the chest? We're good. All right. So what you're seeing is.
Oui, j'entends très, très bien.
I'm sorry. There was something from Raymond who. I'm a little confused about what's going on here.
That's okay.
It's okay. Everything is solved.
Okay. Okay.
Speaking to Claude, I hear. Okay, bye-bye.
All right. All right.
I'm sorry. Go ahead as if nothing
No,
happened.
no problem. No problem. So you can see the connection between, if there's no space between the leg, if the torso is squished down into the leg, naturally the chest is going to collapse. If you create space between the leg and the torso, the chest will be able to expand. That's why gallbladder 29, or it's not exactly 29, you're really trying to get the space around the trochanter, either in front of it or above it. That's that's a connection between that point and the chest. Okay, and that point will also, you can needle it facing up, you can needle it on the side. Some people like to needle it on the side because it's more exposed, or you can needle it when you're face down, and you can check it against both the findings in the front or the rhomboids. So it's kind of flexible. Okay, then when you're on the back, you want to needle this small intestine 9 and 10. So small intestine 9, 10 is between small intestine 9 and 10, you know, wherever you find, and needled up and out towards the deltoid, towards the arm, to open up the chest, to open up the back. And Yao Yan, you know, so basically it's 4 corners. Again, down and out also releases the rhomboids. Okay, so these are points that release the rhomboids. And sorry. So at the end, you want to actually treat on the back. Your target is this UB13 bladder 42 area, and you want to actually needle it. So you treat it as much as you can using Smoitas 910, the Trochanter, Yao Yan, etc. Then you needle it and do direct moxa. And also for many lung problems, the lungs and the diaphragms are highly correlated. So remember that bladder 17 area, look for something almost like a nodule there. That area is considered asthma shoe or diaphragm shoe. Okay. And another combination that can be very effective for lungs or different kinds of lung issues is this combination of use the Huatou of C7, that's Ding Chuan, bladder 13, bladder 17, or bladder 20. Now, Kawai use them all with needle and moxa on top of the needle, Kyutoshin, actual big moxa. I use just Okyu, I just use direct moxa. So there's a needle, and then I do direct moxa on top of the needle. I don't like the smoke on top of the needle because it's very hard to get rid of the smell. So I'm just not a big Kyutoshin person, big moxa on the needle. I literally only use direct moxa. Okay, so now with the spleen, so we're basically going through the 5 organs sort of thing. There are a few different spleen types. Okay, so the spleen 9 ones, okay, the findings that correlate to that are in red, and the spleen 3 types, those are the 2 major types, spleen 9 and spleen 3 is in yellow. Now, what you're going to find, when someone comes in and they're from the waist up, they're very skinny, but from the waist down, they have a big butt and thick legs. You generally think, oh, it's a spleen type. Now, of course, lots of people are spleen types and they don't have this body type. But I'm just saying, when someone like that comes, start thinking, oh, probably spleen type. With the liver, it's the opposite. Liver has a rounded belly, like a beer belly, or rounded for women, not so much beer, and skinny, skinny legs. When there's a disproportion between the thighs and the abdomen and the torso, that's when you sort of go, oh, maybe spleen type, oh, maybe liver type. Okay? So the spleen 9 type is someone who's had, almost anybody who's had their appendix removed is likely to be a spleen 9 type. Spleen 9 is going to be important for them. They will show on left stomach 26, 27. They'll have bloating. So this bloating, you take your whole palm and press it just above the inguinal groove, not into the inguinal groove. And it's the whole palm that's pressing. That's a spleen 9 type. And then spleen 9 type people will have gallbladder 21, one spot, an exact spot. They'll say, I have pain there. Okay. By the way, that's a little bit more typical on the right side, that gallbladder 21 pain, but spleen 9 will still work even if it's just on the left side. Okay. And then, by the way, there is a correlation that's not acknowledged often between if you've had your appendix removed or appendix problems, over, say, 2 or 3 decades, you may develop gallbladder problems. Okay, so there's some inflammatory process that starts on the right side, starts at the appendix and then shoots up. And that's kind of the thinking behind why gallbladder 21 then hurts.
Can you repeat your last? That was fast.
Okay.
A little bit.
Yeah.
Just relax your pace just a bit.
Yeah, I will try.
Thanks, because it's important information. So
of course. So what happens is, if you've had your spleen removed, there's a possibility, there's statistically likely that you will have gallbladder problems 20, 30
Spleen or
years later.
appendix?
Is it spleen or appendix?
Appendix problem. If you have an appendix issue, 20 or 30 or more years later, you're statistically more likely to have gallbladder issues. It's an inflammatory condition on the right side that starts to move upwards. And then as it moves upwards, it expresses itself as muscular pain in gallbladder 21. Does that make sense? I'll assume yes. Then you have the spleen 3 type, which in terms, so this is the sugar type, and also somebody who has muscular pain. So make sure that's not the muscular pain on gallbladder 21, because that will be spleen 9, but muscular pain all over the place, anywhere, is often a spleen 3 type. Muscles and sugar, muscle and energy are highly correlated. Okay, so think about when you're eating lots of sugar. Of course, none of us do, but if we do, you know, your muscles get ready and they're ready to do things, and then you get the sugar low. And then you feel like, oh, can't do anything anymore. And if you do this enough times, if your sugar metabolism keeps going up and down, your sugar blood levels, your muscles either get contracted, they stay in contraction, as in being ready to do something because there's energy, or they stay in atrophy because like in the sugar low. So any kind of muscular problems, always think of spleen 3 as a possibility. And the one reflex that can show for the spleen 3 type are the scalings, which we saw before when we looked at the neck. Okay? And on the back, both types, look at T11, T12, the Wattos of thoracic 11 and 12. Now, there are some other spleen types, okay, that are important. So we use spleen 7 for edema, for bleeding. So I don't use spleen 1 as a stop bleeding point. I use spleen 7. We use that for ear infections. And it's very important to find that hole, that dent, that pitting edema just behind the bone. It's literally touching the bone just behind it. Okay, so spleen 7 is a very important point. We consider spleen 7 to be a point that is on the spleen channel but has kidney style functions. Okay, so you can say, for example, edema or ear is related to kidneys in Chinese medicine. So there's some commonality, and when we look at the liver, I'll explain a little bit more about that. And then spleen 6 for patients who have anemia or blood pressure problems, or people who have top of the head headaches at the top of the head. Okay, that's a spleen 6 type. All right. So now we're getting to the liver. So we know that it shows on the under the ribs on the right side and or liver 14. Usually more under the ribs is more common. And on the back, it will show on the right side of bladder 17 to 18 or the Wattos on the right side. And this, when someone walks in, they're the opposite of the spleen shape. They're the apple shape. They have skinny, skinny legs and a rounded abdomen on the above it. They don't match. You start thinking, wow, you're probably a liver type. Okay. Now with liver, we have to differentiate excess or deficiency. Okay. The excess means if you're pressing on under the ribs on the right side or liver 14, and they go ouch, they jump. That's we'll consider to be physical liver damage, an excess liver. The treatment for that is right side, kidney 7, spleen 7, here again, heart 3, and pericardium 4. Now, let me just, for a second, show you this famous pericardium 4. So pericardium 4 is, with me, you can see it very clearly. There's a dent here, 3 fingers below pericardium 3. My pericardium 3 is between the 2 tendons, not medial, between the 2. Okay, and if you just slide your finger lightly, you will stop. Even people who are, you know, because I'm fairly well pronounced here, but most people, you can just slide your finger, don't press, just slide, and you'll dip into a hole. The point is called shi, man. Shi is like the shi of cleft points. Okay, a crack. Shi means a crack. Okay, so the point itself tells you that there has to be a crack there. Okay, and if you take the textbook location, I don't know what it is, 5 and above, something like that, there's no crack. There's no shi there. So there's no point in naming the name that way. Naming the point that way, I mean. So, sorry. Now, this treatment idea originally comes from, this is Nagano's treatment for people who are atomic bomb victims. Okay, where the liver has been damaged because of the radiation. And his understanding, the way he arrived at the treatment is, there is a sentence in the difficult questions that it asks a question about, like, how come, supposedly, according to 5-element theory, the lung is supposed to control the liver. So if we have liver excess, we should be tonifying the lung, so the lung will control the liver better. That's the rule of the 5 elements, you know. So, and the question is something about the Eastern Mountains, Western Mountains. Basically, it's the lung and the liver. That the Western Mountains, the lung cannot control the Eastern Mountains, the liver. And the answer is no. In a case of liver excess, you tonify the mother, which is water. Water is the mother of wood. So that's tonifying the kidney. That's kidney 7. And spleen 7, I told you, is like a kidney point in some instances. And you also
Can you repeat which the liver is the kidney point? I didn't get that.
Okay. So liver is wood. And it says that in case of liver excess, do not go to the grandparent, which is the lungs. Don't bother with the lungs, with wood, okay? Don't use the control cycle, whatever that means. Use the other rules. So liver excess, it says, tonify the mother. The mother of wood is water. That means kidney. So that's the points that we're using here is kidney 7. We're also using spleen 7 as if it was a kidney point, because for Nagano, spleen 7 was somewhat of a kidney point. Then, difficult questions also says, it says, then also reduce the sun. The sun of wood is fire. Okay, so that's the heart 3 and the pericardium 4. Now, notice this. You either tonify the mother or you reduce the sun. You tonify the mother for deficiency, you reduce the sun for excess. What he's saying is you do both for excess, for liver. That's a special case. There's an acknowledgement that liver excess involves a deficiency. The reason why you have, say, liver yang rising or, you know, liver fire, blah, there's not enough blood. When you look at any formula that treats the liver, that has harsh liver scrubbers, when you're scrubbing the liver, okay, with herbs like jitsu or, you know, things like that, you always put bai shao, peony, in the formula in order to nourish the blood. So with liver is like a sponge. It has a lot of blood in it. If there's not enough blood, the sponge gets dry and it gets thorny. So you can't just get rid of the excess. You have to tonify the blood for liver, in liver excess. Okay, that's a principle that gets followed even though people don't express it so clearly, like in this point formula, but you can see it herbally a lot. They just automatically do it. Okay, so that's one kind of liver excess, when there's, like, for example, hepatitis would be one of those. Then there's a type of liver that has, it can show as deficiency or excess. It's kind of weird. And that's the one that has liver 2 pressure pain. And for that, liver 2 is the fire point. So we use liver 4 and liver 8 because those are the metal and the water points. Metal and water. Water overcomes fire. And metal is the mother of water. So it helps the water overcome fire. Okay. This type, it's very typical for people who are alcoholics or were alcoholics in the past, but not yet physical damage in the liver. And also typical for people who've never touched alcohol, but have parents and great-grandparents, etc., you know, a culture that's very strongly alcohol-oriented. Okay, it's very interesting. that many people say, I don't touch it. I've seen what it does to my parents. I've never touched it. And yet their liver shows. Because if enough generations have been drinking a lot, the liver starts to change, and there's a change in the transmission of the genes. Then you have another liver type that's an excess, that's they have mouth sores, like herpes in the mouth or things like that. We don't consider that stomach heat. We consider that liver excess. And the treatment for that is liver 3 and spleen 3, and you're going to use it on both sides. Because in the mouth, it's in the center. It's not just right side like the liver. Okay. Then you have, the liver deficient type, meaning you press under the ribs and if they say, oh yeah, something dull, something weird, but not sharp. They're not jumping. So that's a liver 1 type. Okay. Now, notice that you have at least 5 different situations for liver 1. Add to it 1, think of pericardium 9, how pericardium 9 is at the tip of the finger, and place that pericardium 9 on the big toe. So you're going to have one more around here, if you can see the cursor. Okay, and that one is for eyes, is a very good point for eyes. But for other than eyes, usually it's going to be one of those 5 points. Okay, and I prefer the one that looks like a true Jingwell point. But notice that the text never gives you a true Jingwell point for liver 1. They always say, 3 hairs away from the, it's different. The description for liver 1 is different than all the other Jingwell points. Okay, so, but some patients, it might be different than the others. So you just have to pick up the one that's going to do the best job for the liver by palpation. Okay. And then you have a fatty liver type. Okay. So let's start with a non-obese patient because it's simpler. Okay. The abbreviated treatment is right stomach 25 and right liver 13. However, when someone's really big, like they're really obese, if you just do that, there's so much fat, there's so much accumulation there, the needles don't transmit the message. So what you do is you try to push the right stomach 25 and the right liver 13 already from the left. So you start with left gallbladder 26, left stomach 27.
That was fast again. Can you repeat the sequence for the obese patients starting?
Okay, it's written, by the way. So it's you start from the left to push it towards the right. So then by the time you get to the right, you have some energy. So you do left gallbladder 26, left stomach 27, Ren 6, and then right stomach 25, right liver 13. So you got something going first, because obese people, everything is the needles are going to work very slowly. There's too much dampness. Okay. By the way, that's true, for example, if you're doing other treatments, if you're doing, say, adrenal treatment and you're doing kidney point, you may want to add a point on the thigh to push the points further. So if you're doing kidney 7, for example, you might want to also do inner yin, which is on the kidney channel. Okay, which is on the thigh, just because with obese patients, one needle is just, it's not enough to penetrate. It's not about depth. It's about the number of needles, to give an extra push after a certain distance. Okay? Now, with a fatty liver type, liver 8 usually does a very good job. So you do liver 8, and then you do the abdomen. Okay. And then you have a bunch of liver types that are a little less clear. So first of all, there's the type that, by history, there was toxicity, like they worked in a paint factory or they lived in a place next to some horrible factory, breathing in the smoke or whatever, something like that. That's a kidney 9 and a large intestine 15 type. Okay. And that type you see a fair amount of. Okay, now this combination is also a skin combination. And sometimes you will find, especially if they have oozing skin, you may find that liver 5, you need to add liver 5, moxa on liver 5. Okay. Then you have a type that's undefined. You know, you're not sure if maybe it's mixed. You're not sure if it's excess or deficiency. So you can't do either because you don't want to push it in one direction that's not the one you want. So you can use kidney 9. And here gallbladder 28 is the one that's in the inguinal. It's the regular textbook one. Needle towards the leg. And just to the right of DO20, between the gallbladder and the bladder channel, you may find on the right side, you may find like a dent in the skull, like a little hole, like a little depression. That's very good for liver also. On the back, all the liver types, no matter which one, you can do left bladder 35. Okay, this is a left-sided point for the liver, which is on the right side. Left bladder 35 releases right side UB17-18 area. Then if you want, you can needle that liver area on the back, not on the front. Don't needle liver 14, for example, but you can needle UB17-18 area. Okay? Okay,
I
so
have a question.
yes, please.
You talked about a skin condition. I'm not quite sure I understood.
Sorry, I talked about the skin condition, and what was the question?
Yeah, you mentioned somewhere in this explanation of the toxic liver skin condition, but I was not sure what you were referring to.
It's the same. Okay, so for skin, the treatment, the basic treatment for skin is the same as for the toxic liver type, kidney 9 plus large intestine 15.
Okay, thank you.
Now to that you will add other things possibly, and for example liver 5, for example UB63. There are more. You know, there will be a skin thing in a little bit. Okay, so
thank you.
You're welcome. So the kidneys. Okay, so we're primarily looking at adrenals when we say kidneys. Okay, so they show as right under kidney 16, 4 o'clock and 8 o'clock. It may show as kidney 2 pain, pressure pain. That's also an adrenal issue. What happens, the point, kidney 2 is called the blazing valley, but valley can also, if you add a teeny character to it, it also means blazing desires. If I'm constantly running after my desires, like adrenal, I'm constantly running. Kidney 2, which is what you're not always stepping on, but very close to what you're stepping on, is going to start being painful because I'm constantly running, sort of thing. On the back, the adrenal type often shows what we call valley back. A valley back is the kind of back where you see that when they're lying face down, the spine, you see the spine and you see the paraspinals, the muscles next to it, very tight. And it's as if the spine itself is in a valley between those two mountains of the paraspinals. And some people, you see it just when they lie down. It's like, wow, why is this so tight? And some people, you see it if they lift their head up. Then suddenly you see that it's very tight in the lumbar spine. And they may have quadratus lumborum pain also. The physical kidney, so these are the adrenals, the physical kidney, like for example, people, you know, with various kidney disorders of kidney filtration, okay, show somewhere between kidney 16 and spleen 15. It's impossible to tell. It can be more in the stomach channel, can be more towards the center, can be
in between what points?
Kidney 16 and spleen 15. So level of the navel, and it can go all the way out to spleen 15. You can't tell exactly where it's going to show because it depends on the size of the kidney and where in the kidney it might be problematic. So it can show conceivably all the way. Kidney 16, stomach 25, spleen 15. Anywhere in that line, the physical kidney can reflect. Okay. And kidney stones show when you tap, you don't press, but you tap with 4 fingers, or 5 fingers if you want, on gallbladder 26. That's when you have an active kidney stone. Okay. And if you have tight gallbladder 26, which we've seen before, sometimes it could be either a structural thing, a muscular thing, or people who eat a lot of salt can develop a tight gallbladder 26. So it's not always structural. Okay. So the treatment, original treatment is kidney 6 and kidney 27 together on both sides. Now, you can substitute kidney 6, different options. So if you have kidney 2 pain on the side that you're about to needle, you don't use kidney 6, but use kidney 7 and kidney 10. Again, that's the metal and water points. Kidney 2 is a fire point. If there is a lung issue with inhalation problems, you will probably choose kidney 4, needle down towards the heel, rather than kidney 6. If the person has jaw problems, neck problems, or a goiter, or various emotional issues, very often, I would use kidney 9 instead of kidney 6. And people who have had brain injuries, sometimes they will have like just above kidney 3, but not anywhere near as high as 7. There will be a little nodule, and that relates to brain things. So you might use that kidney 3, that nodule, needle into the nodule instead of kidney 6. But all of them get kidney 27. Now, the physical kidney is usually either kidney 7 or kidney 9. So the dialysis types, etc. Now, just for your information, again, that's not typical in the textbooks. But there are other, I did not invent this. There are other doctors who say the exact same thing, but it's also not in the Western textbooks, strangely enough. Many people who are on dialysis have beforehand had issues with the liver. When the liver does not detoxify well enough, the kidney has to go on overload to filtrate. So just be aware of that. So sometimes for kidney issues, you have to treat the liver first. Okay. So then we have the immune type. Okay. Sorry, I know we've done 4. There's an organ missing, and oh no, we've done all 5 organs. Okay, we're good. So the immune type is the type that, you know, they've had tonsillectomy, nasal allergies, all sorts of things like that on the body, and they have weak immunity. They complain, I have allergies, I have something. They will show very likely on Sanjiao 16, the area of Sanjiao 16 behind the SCM. They also often complain of pain on the back, but it's across the posterior iliac crest. Okay, so they're saying it goes across the spine. It's a wide pain. It's not on the spine, and it's not in the waist. It's below the waist. Okay, and these people will often have temporal headaches around the point of Taiyang, you know, on the side. Okay. Other reflections besides Sanjiao 16 will be the right stomach 26, 27 might show also. The treatment for immune is the immune point, which is just below large intestine 11, but on more Sanjiao, a little bit more towards the Sanjiao. You're looking on the edge of the bone, and you're looking for some weird, the way the muscle and the bone touch feels weird there. Okay, when you palpate, you will know what I mean. Okay, and you needle it.
Could you show it, please? Could you show it on your arm?
I can try. I don't know how much you'll see, but I can try. Hold on. Okay. So this is large intestine 11. But the bone is here. So this is the large intestine channel. I go on the bone, and I'm looking. I'm always looking. It's not an exact location. And I'm looking for something where I feel something kind of weird about how the muscle and the bone touch each other. When you touch it, you will know, but it has to be on the, it has to touch the bone. If it doesn't touch the bone, it's not really the immune point. But you're needling the muscle, you're not needling the bone.
Thank you.
Okay, so, okay. So, DO 14 is an immune point. DO 12 is a DO point. DO 12 is an immune point. And you see this area in red under the scapular spine. That's very good for lung infections, things of that nature, and lymph nodes, and lymph issues. Okay, so this is the immune type. Okay, Then there's a very big category of the autonomic nervous system. Okay. And part of the problem here is there's no reflex that you can say, oh, if you have Ren 17, it's an autonomic nervous system. No, no such thing. It really doesn't exist. But here are some reflexes that are likely to be found in the autonomic nervous system type. And then I will tell you that it's really all about the pulse. Okay, so they could have a tight SCM because it presses on the vagus nerve. They might have occipital issues because that area of the occiput is, right now we'll call it the Anmien area, the peaceful sleep area, but you can see that even because Anmien is an extra point, but the points that do exist officially have either the character wind in it or the character brain in it. Okay, so there's something about relaxing the brain on the occiput. They may have a tight diaphragm, which means that they'll have, besides the fact that the diaphragm will be extended, you can see that the chest is, kind of extended. They will also, on C3 in the neck, because that's the phrenic nerve, they may have pressure pain there. They may have pressure pain around liver 12, spleen 12. Okay, when that area gets pushed, liver 12 itself is called jimai, the hasty pulse. Okay, the rushing pulse. So when people are, they're in sympathetic mode, liver 12 can show. Okay, Ren 17 might show, Ren 9 might show, and on the back, T2 through T9, that's the Shen area. Okay, and this is another big one, the left inner border of the scapula, left bladder 43, 44. This is not a cardiac phenomenon. This is different, even though it's related to the heart. The reason it shows there is because of the heart, but it's not a heart pathology. It's because the pacemaker, your own heart pacemaker, is a nerve bundle. It relates to the nervous system. So therefore, these are people who can show. And by the way, 80 to 90% of all patients have pressure pain on left UB 43, 44. It's almost, I can guarantee that. Okay, and I use Do2. I release it with Do2, just so that you know. So
I have a question.
Yes.
I just want to be sure I understand the idea. So you do the map at the beginning, the palpation with the history, you identify which system or organ you think is to address. And then with those protocol of points, is the idea of what you just did in the video to, let's say, palpate those points and then check if the pain reduced, then you do the point, or you do all those points? I want to...
You decide. I mean, it's impossible to tell. I mean,
it depends.
Yeah, I mean, I'm giving you some options, but yeah, I mean, okay. So for example, with the liver, liver excess, it's kidney 7 plus spleen 7 plus heart 3 plus pericardium 4. It's all in one. It goes together. Okay. Now, let's say they have a terrible burn on spleen 7. You can't do it. Okay, so you don't do that one. But so like adrenal treatment is kidney 6 plus kidney 27. It's not, kidney 6 alone is not an adrenal treatment. We do add kidney 27, even though it doesn't look like it's doing much, it does. Okay, so you can't, yeah, sometimes you might shorten the protocol, but remember, I'm not looking at number of needles. So if I'm giving you a protocol, it's the whole thing. But if I'm giving you choices, for example, when I told you about the scalings, use spleen 3 or lung 8 or heart 3 or yin, or you may have to use all 4 of them. I can't, it's impossible to tell. But so some it's the whole thing, and some it's, you use what you can, what's needed. Okay.
I see the idea. I understand. Thank you.
Okay, no problem. All right, so back to here. Okay, so some of the symptoms of nervous system disorders are people who have insomnia, people who have palpitations, they sweat easily, their hands and feet sweat easily. You touch their hands, you go, oh my God, what's going on here? Okay, they may have cold hands and feet. Now, some of these symptoms come from other things as well. For example, palpitations may not be a nervous system disorder, may be a true heart disease. Cold hands and feet may not be an autonomic nervous system disorder, may be a thyroid disorder, which is related, but still different. Also, it can be an estrogen problem because estrogen constricts blood vessels. So they can have all these symptoms can be from something else. If I suspect that they're a nervous system disorder type person, I ask them, do you get startled easily? They ask, what do you mean? So I say, if someone starts a motorcycle behind you, do you jump? Some people don't care, and some people automatically jump. These often, they'll have anxiety, depression, panic. They'll have the unusual blood pressure. And often that blood pressure will be low, so they don't even know that there's an issue with the blood pressure because they go to the doctor and the doctor says, yeah, you're very nervous, your nervous system is very weird, but your blood pressure is great. I don't understand. Because stress does not always produce high blood pressure, okay? The stress can be induced because the body has weird blood pressure to begin with, and therefore you're feeling the stress, you're not coping with stress well, okay? And just remember that in parasympathetic mode, okay, so when you're not in sympathetic mode, you're in parasympathetic mode, you have more peristalsis, you have more urine, and you will get heartburn because the stomach is always ready for food. So some people, it's a little bit rare, granted, most people will be sympathetic problem. Some people are too much parasympathetic. Now, those people who are too much parasympathetic, no, they don't look like, yo, man, everything is fine, I'm so relaxed. No, but in their nervous system, their personality can still be a type A. But in their nervous system, the parasympathetic is overactive. So they're complaining that I'm constantly, like I have too many bowel movements. I'm constantly urinating, or I get heartburn. So it's a possibility for that too. Okay, so just be aware of that. Now, then there's no actual finding, but the pulse is very clear. Okay, so I just let's go over this pulse. This is a pulse we call a tight pulse, okay? Now, the TCM people will call this pulse wiry, but it's not really wiry, and this is why. Wiry pulse is an excess pulse. That's the definition of a wiry pulse. A pulse that has that sharp quality, but is an excess pulse, is wiry. A pulse that's thin and wiry, and when you press on it, it either disappears altogether or it changes the quality. It becomes a little bit more rolling. That's a tight pulse. That's not an excess pulse. Okay, so wiry is a clear excess pulse. Tight is not an excess pulse. It's actually somewhat deficient. That kind of pulse, and the main thing about this pulse is that it changes the quality when you press deeper. It either disappears altogether or there's a softness that suddenly comes in. That tightness disappears and it becomes soft. That's considered an autonomic nervous system pulse. Okay? And with that pulse, you need to know whether it's rapid or slow. Regular pulse doesn't matter, but rapid or slow is going to matter because that pulse gets treated with a point under the third toe. We talked about a point under the second toe. For heart, very rapid heartbeat. Under the third toe, we use, but we should not use under the third toe if the pulse is slow. Okay, only rapid or regular pulse. However, if you can tell from the pulse, you can say, yes, very clearly, tight pulse, disappears on pressure, changes quality on pressure. You're very confident from the pulse, thin, wiry, disappears on pressure. You can use under the third toe, even with slow pulse. Then release the SCM, Sanjiao 8, opposite side of the SCM, for the slow or the regular pulse. But for the rapid pulse, often Sanjiao 5 is a better for rapid pulse. Use the pericardium channel, and meaning check pericardium 8 first. If pericardium 8 is painful, use pericardium 3 and 5. If pericardium 8 is not painful, I prefer pericardium 4, the one with a crack, but you can also use pericardium 6. It's okay, either way. The thing about pericardium 4 is you don't have any chance of painful, because there's no tendons that you have to worry about, like with pericardium 6. Then, if the pulse is rapid, you can use Ren 6, and you can use liver 12 needle towards the pubic bone. So it's up and inwards. Okay, but don't do that for a slow pulse. Okay, on the back, use DO2, and especially I check DO2 against the left inner border of the scapula. Then use small intestine 9-10. This small intestine 9-10 is a point that I use lots on almost everyone. And then T5, T7, something like that. You know, just look for something that's weird, gummy, you know, on the Wattos and needle dose. Okay, so that's the autonomic nervous system type. Now, so we saw 3 types up to now that correlate to each other historically. Okay, in people's medical history. You can start with an immune problem. And the immune problem, if you have immune problems for a long time, it's going to start pulling on your adrenals. And then it's going to start pulling on your nervous system. But this cycle, so the 3, often you'll see people have all 3 together. Okay, you don't know which started which is why you need the story. Okay, but chances are you'll need to treat all 3 of those, at least to some extent. Okay, so people might have had a big shock, you know, have had an adrenal problem, or they may have had a lot of stress in their lives, which is a slow adrenal problem. Okay, so it could have started with the nervous system, could have started with the adrenal, and eventually reached the immune system. It could have started with the immune system and eventually reached the adrenals and the nervous system. But those 3 are constantly interacting, and they're going to pull each other towards each other. And add to that, both between the adrenal and the nervous system, there's another one, which is the thyroid. The thyroid tends to work into this also. Okay, so just be aware that they are not quite as separate as I'm making them sound. Okay, and we'll do the blood pressure, and then we'll take a break for a few moments. So the blood pressure disorder type, in a way, it's an autonomic nervous system disorder, but it's a separate category. So this is, yes, it's the high blood pressure, it's the low blood pressure, but especially it's the weird gap type. Okay? And there is no real reflex for blood pressure. However, it can show on the occiput, gallbladder 20, UB10 area. There can be some puffiness on that tissue. It won't necessarily be pain, but when you're touching it, you're going like, why is your bone hiding behind extra tissue? Okay, and the treatment for that, and this is a treatment I use a lot. Okay, this is one of the spleen pericardium treatments. Okay, which I told you is a big axis, spleen pericardium. So this treatment for blood pressure disorder, doesn't matter high, low, or weird. Spleen 6. Spleen 9 needled upwards, totally upwards, okay, not towards gallbladder 34, plus pericardium. You know what pericardium means. Check pericardium 8, okay. Pain on pericardium 8, use pericardium 3 and 5, metal water. No pain on pericardium 8, choose between 4 and 6. And it's my 4, the one 3 fingers below. Then add the point under the 3rd toe. Okay, that's a blood pressure point.
Can you repeat, because it's a little bit fast? So if, because this one seems, you repeat it a lot, 8 pericardium. If it's painful,
we've done it many times. It's the same.
Yeah.
It's the same.
Yeah.
Same.
So if it's painful, you do 3 and 5. If
Yes.
it's not, you do
6 or 4.
Thank you.
Okay, either pericardium 6 or pericardium 4. Pericardium 4 is the one that I use, the one 3 fingers below 3. Now, let me just explain something. Pericardium 8, you need to check pericardium 8. However, most people won't have anything there. Most people. Now, okay, there will be some people, say 20, 30% of people will have a pericardium 8 that's painful. So you need to do 3 and 5. No one ever has shown both sides pericardium 8 pain. There's something very unusual about it. I found it a few times. I said no, and it's not true. And there was always some explanation about why there was something weird about why. It's usually if one side is painful, the other one is not. Okay, it's if both pericardium 8s are painful, it suggests some weird pathology. Okay, the people who have both, the few people I've seen, have had really crazy issues in their bodies. Okay, so just be aware that usually you'll just find one pericardium 8. So under the third toe is the main point for blood pressure, but you cannot use this point if the pulse is slow. You can use this point if the pulse is slow, and the pulse is what I called tight pulse. Thin, wiry, disappears on pressure. On the back for blood pressure, use the autonomic nervous system shoe points, the asthma shoe points, UB17, and again, small intestine 9-10. Okay, out towards the deltoid. Okay, so let's stop here for 10 minutes and come back.
I agree with 10 minutes. Thank you.
Okay, so we'll come back in 10 minutes and we'll continue.
Thank you.
All right, thanks. All right, so we will continue. So the Ren 9 pulse, I already mentioned to you that this is very, very common nowadays. And it indicates that the lower abdomen is weak. It's a weak lower Dantian. Okay. And basically what you're finding is that around Ren 9, there's a pulse, but it's not going to be just at Ren 9. Sometimes you are touching the abdomen and you can already tell, oh, wow, there's going to be a pulse. Some people, you can even see it. Okay. That's a little extreme, but it does happen. And it often comes with left spleen 20 because it is a circulatory issue. So there is a kind of a cardiac phenomenon involved here. Okay. So I say what you do is you use this side gallbladder 28. Okay. The Mushu. Okay. Level with Ren 4, go all the way to the side. That's the main point. And I might even add bladder 2 to it. Okay. In fact, I will add a kidney point to it and I will add inner yin to it. Okay. You'll see that later, the reasoning why. The official treatment for it is right stomach 24. Okay. And needle it slightly outwards. Don't needle it 90 degrees, but needle it to, stomach 24, out towards, slightly towards the spleen channel. And then left gallbladder 26. My personal experience with that, it doesn't do as good a job. Okay, the Mushu thing does a better job. On the back, if you felt a Ren 9 pulse, do bladder 52, needle inwards towards the spine, strengthening the kidneys. Okay. And whoops, sorry. Okay, now the thyroid type. Okay, this is mostly women. It's not very common for men to have thyroid issues, but it can happen. But generally it's women. It will reflect on stomach 9 and on the SCM, the middle and the lower part of the SCM. It's not going to show on the very top part of the SCM. And the thyroid is considered to be in the kidney domain. The thyroid, number one, it's a gland. It's a hormonal gland, so it belongs in kidneys. Number two, the kidney channel circulates the throat. So that's very different than the TCM thinking that says it's something to do with heart fire or spleen or stomach. For us, thyroid is definitely in the kidney domain, and we treat accordingly. So originally, it's supposed to be kidney 3, which you needle towards the Achilles, is supposed to be for hypo, for low thyroid. And kidney 7 is for hyperthyroid, and kidney 9 is if you have a goiter on the thyroid. Quite honestly, don't rely on this, and just check the kidney points you want to use against the thyroid itself. And generally speaking, I can tell you that for me, hypo or hyper, kidney 7 seems to do a better job for both, either way. So kidney 3 is not, theoretically, maybe it was supposed to be a great point, but I personally don't find it so useful. Then you can also add stomach chi points. What are stomach chi points? Stomach chi are the points on the stomach channel below stomach 40, between stomach 40 and stomach 41, and you find bumps. And why? Because by channel, the stomach channel goes to the thyroid. The stomach 9 is the thyroid reflex, right? So that can give you a certain amount of mileage also. It can add, okay? Then if they're low thyroid, what does low thyroid mean if we translate it to Chinese terms? Low thyroid is like no yang, deficiency of yang, right? So we want to activate the DO. So to activate the DO, I use DO2, needled upwards, T11, T12. Notice that L2, DO4 is in parentheses. You might or might not use it. I prefer to use UB52. So T11, T12, T7, and T5. Now, is it really T7 or T9? Is it really T5 or T4? No big deal. Okay, you're activating the spine to activate the yang, to get more yang going. Somebody has thyroid issues, consider that it's possibly an autoimmune issue, but be careful. Nowadays, they pronounce everybody with thyroid problems, they say autoimmune. Everybody's Hashimoto's. I think that's a bit of a fashion. I'm not so sure that it's true. Okay, so you can't just say, oh, yeah, they've been diagnosed Hashimoto's, must be autoimmune, because just about everybody with thyroid problems nowadays is considered autoimmune. Okay, and I'm not sure. And also, thyroid considered the toxicity treatment. Why? Because the thyroid is very, very susceptible to toxicity. You know, radiation, for example, is a big deal with thyroid. So, and that brings us to this notion that with cancer, anybody in
we could consider heavy metals in that category. Heavy metal toxicity for the thyroid.
It's possible. I can't say, oh wow, I've seen it, but it's possible that it will affect the thyroid, because the thing is, okay, what happens is if you're asking your metabolism to work faster than it does. Okay, so if you have heavy metals or something and you're trying to chelate them, the body is trying to throw them out. The body's going to try and push out the metabolism. It's going to try and speed up the metabolism. The metals are not going away because they're not so easily pushed away. They're thrown into the cellular substrate of the body. So there is a possibility that the body is constantly going to try and hype up the metabolism. And then the thyroid is going to get affected. Okay, so yes, it's possible that heavy metals will affect the thyroid. Now, if your question was, is the toxicity treatment a treatment for heavy metals? The answer is yes. And to that, I would add, at the very least, UB63. The name is the gate of metal. Okay, so anything to do with metal, I use UB63. Okay, so for example, you have metal in your hip or metal in your elbow or metal and it's hurting. Think about UB63. Doesn't mean it always works, but it's worth trying. Okay, so with cancer, it's very important. The two things you need to almost always treat with people with cancer is the liver, detoxifying, and the thyroid metabolism. Okay, so just be aware of that. Then you have the sugar type. Okay, so these are people who, they'll have, they're susceptible to sugar. They just love carbs. You know, I can tell you I'm a sugar type. I mean, if I can eat all the vegetables and the fruits in the world, and I don't, it's like I didn't eat anything. It's like until I eat a piece of bread or ice cream or something, it doesn't have to be sweet, but has to be carbs. I don't feel like, wow, I really ate. Okay. Some people are not like that. Some people, if they don't eat protein, they don't feel that they ate. You know, there's different types. The sugar imbalance type tends to be addicted to carbs. And sometimes they'll tell you, I can't touch bread. If I do, it just, the whole day I'm just eating and eating and eating and eating and eating. Okay. So if they just have a sugar imbalance, the main points for them is spleen 3. And on the back, it's T11, T12, the Wattos of T11, T12. And the Wattos I needle either towards the spine or better still up and in towards the spine. So a little bit up, especially T11, 12, because at T11, T12, there's a falling down of the thoracic spine down into the waist. So you actually want to push the needle, push the spine upwards there a little bit. So the needle helps that message of lifting up. Okay. For the diabetes, we talked about, we saw that in that little video, that spleen 3, just like for the sugar, and T11, T12, just like for the sugar, but also add to it adrenal, which means a kidney point below the knee, plus kidney 27, plus immune, plus the OD, the right stomach 22, aligned 45 degrees from the navel to the ribs, halfway between, on the right side. Spleen 3 is a great point for muscular pain, any muscular pain. The OD point is a great point for muscular pain, but also for bruising style pain. If somebody says, it feels like it's bruised, there's no bruise there, but that's what it feels like to them. That's OD point, right stomach 22, it does a good job. Some diabetics are an autoimmune issue. So we're going to see autoimmune in a moment. So add Ren 4 to it. Okay. And also diabetics can have liver issues. So consider the fatty liver treatment for diabetics also. Some diabetics, the problem is not so much in the pancreas, the problem is in the glycogen, how the liver releases glycogen. Okay, not terribly typical, but it can be a cofactor, even in normal diabetics, so to speak. Okay. Now we have a type that we call lack of stomach chi. You can diagnose it a few different ways. Okay. One is you just slide on the stomach channel very close to the bone. Okay. And you feeling these bumps. You know, it's more typical with women, but some men have it. Okay. And you're feeling bumpy, 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 bumpy. That's stomach chi. Those points of stomach chi, and just the existence of these bumps puts them in this category. Okay. There's also a stomach chi in the pulse. So you know, it's said that the pulse should have Shen, stomach chi, and depth. What is this stomach chi that the pulse has to have? Nagano says that the stomach chi is that movement forward. He said it differently, but it doesn't, you know, it's about as good as I can explain it. So when you touch the pulse, and all you feeling, I'm going to stop this share. Well, I don't know if you could, you actually won't see anything, so it won't matter. When you touch the pulse, and all you feeling is that the pulse rises against you into your finger, but it doesn't roll, it doesn't rise forward and dies and dissipates forward. So there's no rolling motion to the pulse. That is considered a lack of stomach chi. It just beats up, not up, forward, down, up, forward, down, up, forward, down. Okay. That's a lack of stomach chi in the pulse. Some people, you can even feel the pulse moving backwards. The pulse, it feels as if the pulse is not moving towards the thumb. It feels as if the pulse is moving under your fingers towards the elbow. Okay. Now, of course, you know the pulse is not moving that direction, but that's what it feels like. Okay. Now, stomach chi originally is a really good point for knees. Okay, it's a great point for knees. However, stomach 41 is considered one of the stomach chi points, even though there's no bump there. I start with spleen 5, stomach 41. If that doesn't give me a good results, I will look at the stomach chi. I don't look at the stomach chi first. It's a great point, as well as stomach 41 itself, even more so, for any problem with bending or stretching. Okay. By the way, the sacroiliac ligaments are also very good for any problem bending or stretching. Stomach chi is a great points because there's a few of them, and you can needle 3 or 4 of them. You needle them down and towards the bone, so down and medial. Great point for neuropathy. Use it with Ren 12 and use it with Spleen 3 and Lung 8. It's a great point for anything that has to do with adjusting, like seasonal changes, including allergies, and when people can't adjust to the time, like I'm sleeping at the wrong time, or I'm getting over jet lag, something like that. Stomach chi is a good point for that. Okay, so that's another type that we have. Okay, no exact physical finding except either the pulse or the actual point exists. If somebody has a very smooth stomach channel, that's not a stomach chi issue. Okay, but lots and lots of people have stomach chi bumps. No question. And then we have the autoimmune type, which is very popular these days. Okay, now there are officially no real reflexes. I'll give you a few possibilities. Sometimes the mastoid, at the edge of the mastoid, it will show, outside gallbladder 20, so more like towards the sanjiao. Sometimes they'll show, and actually a lot of them really do show, on the sacroiliac ligaments, there's going to be like little ping pong balls. You're going to feel like bumps. That's very typical of autoimmune type. And that's, by the way, a treatment point that we use. And sometimes, now this is definitely not a clear symptom, that sometimes they'll have like their neck will look like it's pinkyish red, almost orangey, not the chest, above the chest and below the chin. But that's not, when you see that, you should suspect autoimmune, but don't assume that autoimmune should have that skin color on the neck. Okay. Autoimmune is considered a systemic inflammation. Okay, the body is producing an inflammatory response in a systemic manner. So the solution is to treat systemically metal and water, meaning kidney points, that will be the water, and lung points, that will be the metal. Okay, so water and metal points, kidney and lung. Which ones? Usually either kidney 7 or kidney 9, might be kidney 6. You might use 6 and 9. It's hard to know what you're gonna find. Say you have kidney 2 pain, you'll use kidney 7 and 10. It's really hard to know. And the lung points, it's usually 5, 8, or 9. And of course, 5 and 8 can go together if you have lung 10 pain. We haven't gone through fire points, but lung 10 is the fire point. So we'll go through that in a moment. Plus, you're using either the shu or the mu of the small intestine, meaning Ren 4 or UB27. And UB27 is on the sacroiliac ligaments, where I told you might have ping pong balls. So you're breaking down those ping pong balls. So basically what it looks like is this. If you have rapid pulse, you'll use Ren 4 plus kidney points and lung points. In a slow pulse, you'll do the same thing, but you won't use Ren 4, and you might use that Mushu point. But you can't ignore the back for slow pulse. And on the back, you will do bladder 27, and you might do a few points on the sacroiliac, plus UB23 or UB52. If it's UB23, needle it down towards the buttocks. If it's UB52, needle it towards the spine. And then UB13 or 42. So again, the same thing, kidney and lung. Okay. And 13, just needle down with the flow of the channel. 42, needle out towards the scapula. If some people have had autoimmune disorders that started with a fever, scarlet fever or something like that, okay, then we have a combination we call ihikon. Okay, that's bladder 60 needled upwards, bladder 58, and bladder 40. The most important one out of all these is the 58. Okay, so the name ihikon comes from the Japanese of in Chinese it's Weizhong, Feiyang, and Kunlun. So you can see the kun for Kunlun. The he comes from what in Chinese is Feiyang, and I guess in Japanese it's Hiyang, and the E is for Weizhong, Yizhong. Okay, that bladder 40 is never exactly bladder 40, never. never in the center of the popliteal fossa. It's always, think of it more as bladder 39, okay, lateral. I have a picture later of it, either still today or for tomorrow. And if it's an autoimmune disorder and they have a rapid pulse, I mean, really rapid, not regular, but really rapid, you can also look at small intestine 1 and 2 and bladder 66, 67. These are the water points, metal water points to reduce heat in the Tai-Yang level, okay, in the Tai-Yang channels. All right, so you're going to encounter this a lot because lots of people have autoimmune disorders. Now, you cannot needle Ren4 if the autoimmune disorder happens to be ulcerative colitis or Crohn's. Why? Because they have inflammation right underneath it, sorry. So Ren4 cannot be used for slow pulse, cannot be used for Crohn's or ulcerative colitis. Okay, you're going to have to use the Mushu instead. Okay.
Yeah, I'm sorry. Can you repeat your last? It was a little fast.
The last thing. Okay. So Ren4 cannot be used under the following conditions: slow pulse or Crohn's, autoimmune Crohn's, autoimmune ulcerative colitis. Because the ulcerative colitis or the Crohn's, they have a problem exactly in this abdomen area in Ren4. So you can't, you don't want to needle into an area that's bleeding, that's inflammatory. So I can't needle Ren4 even though it's called for by the protocol. So I can do my kidneys and my lung points, but Ren4 I have to leave, not do. Instead of Ren4, I can use Mushu, side gallbladder 28. Level with Ren4, go all the way to the side. Okay? No. The hormonal type. So this is generally going to be women. Okay? This reflects on bladder 2, on the occiput, and on small intestine 13, and also that whole area of inner yin. So that doesn't have to be inner yin point itself. That whole inner thigh is going to be bumpy. Okay, so that's a hormonal area. Okay, now all these points, not so much the occiput, but the small intestine 13 and UB2, and certainly inner yin are points that we also use for hormonal issues. So at the end, you know, after you release these areas, you will possibly needle these areas as well. So use them as reflexes and as treatment as well, but first release them. Okay. Now bladder 2, we're using bladder 2 as substitute for bladder 1. And for those of you who are not aware of that, in the Ling Shu, the word Ming Men, okay, that we assume means do 4, does not mean do 4. It means bladder 1. In the description of the bladder channel, it says starts at Ming Men at the eye. That's bladder 1. Okay, so there is something now. It's basically in front of the pituitary, which is why I think it's related to hormones. But obviously, Ming Men is something to do with hormones too. Okay, so there is something that there's a correlation there. Okay, so that those are your hormonal reflexes. Your treatments, okay, are bladder 66 is a hormonal point. It's called the leg communication valley, tongue. Tongue means to communicate or to penetrate, okay? A diplomat, for example, is a tongue, okay? So what do hormones do? They communicate, they penetrate, all right? So it's a great point for hormones. Kidney 10 you can add, but I often prefer kidney 7. Should be, by theory, kidney 10. Why? Bladder 66 is water on water, so relates to hormones. Hormones are very yin. Kidney 10 is also water on water. So theoretically, kidney 10 should be a better point, but I find that kidney 7 does a better job. Inner yin, if there was pain on it, make sure that your bladder 66 or kidney 10 or whatever else you use has been released it. UB2 you can treat. after you released it. The best point to release UB2 usually is small intestine 3. Okay, so use small intestine 3, then you can use UB2. Sometimes liver 9 or inner will resolve UB2, and then you can needle UB2. So then you have a problem. What if inner yin is painful and UB2 is painful? Oh, okay. Do what you can to release inner yin, say with kidney 7, UB66. Then if inner yin, you can now needle inner yin. Hopefully that releases bladder 2. Now you can needle bladder 2 if you want, etc., etc., etc. Okay, so there's always a whole line of thinking around what can I use and in what order. Small intestine 13 is a hormonal point on the back, both as a reflex and after you've released it, you know, to prove that the points you're using are useful, you can needle it on the back itself. And UB32 is a hormonal point to be needled. I don't use it as a reflex. And if somebody took birth control, meaning it's something to do with the pituitary, I use small intestine 3. Okay. Then of course everybody wants to know, wants a good trick for menopausal hot flashes. So first of all, I will tell you, you need to, if you really want to get rid of the flashes in a serious manner, you need to treat once a week for 3 months consistently. Afterwards, you can start reducing. Most women will see results after 3 or 4 weeks, and they'll tell you, can I come less often? Even though you told them that you need to do it for 3 months minimum. And what will happen, then they'll be good for a few more weeks, and then they'll say, oh, my hot flashes are back. Well, yes, because you're not coming once a week for 3 months. So do what you can to explain to them, because I have this experience, not once, not twice, not 10 times, okay? Because they see good results and they think, oh, I'm cured. And unfortunately, that's just not the case. Okay, so menopausal hot flashes are adrenal treatment. Okay, which means kidney 6 and 27, or any kidney point below the knee plus 27, with spleen 9 needled upwards towards the knee, and gallbladder 34, and the inguinals, gallbladder 27, 28, needled towards the leg. Okay. Other hormonal issues are for cysts. Okay, use liver 8. Anybody who has had cysts, use liver 8. Any sort of fat accumulations. It's also the point for fatty liver, for example. Okay, so if a woman said, "Oh, I had a hysterectomy," my first question is why? Why did you have a hysterectomy? No, I'm not against. I just want to know why. And very often, the answer is, "Oh, I had uterine fibroids. I was bleeding too much." That's a liver A type. Doesn't matter that she no longer has the uterus. She is probably a liver 8 type. Okay, cysts and fibroids are, for me, the same thing. It's just a question of where they are. Okay. I'm talking about that. So endometriosis, which is a sort of a hormonal problem, is a liver 5 issue. Okay, liver 5 is the main point for it. Now you have a type that, and we'll see that again, in much more detail. They're sort of, everything is falling down. Okay, so they come, when they walk, they're shuffling their feet. When they're sitting, their heels don't touch the ground, not because they can't, but just because they sit in a certain way. And they're just sinking down. Okay, you need to lift them up. And we'll talk about that more. So this is the protocol for lifting someone up. I call it, you want to extend them. They're all like squished down. Okay, so it's a little bit like when we try to do this thing with gallbladder 29 to see why gallbladder 29 opens up the chest. If I'm extending at the hips, I'm also extending the whole torso. Okay, it's very important to be able to extend the torso, to give space for the organs. Okay, that type is, you can be either kidney 6, but it can also be kidney 7. Inner yin is a very important point. I have one student that only uses inner yin for the whole protocol. Somebody asked me, can you use just one point after the whole protocol? Here is an example. He just uses inner yin for this whole thing and says, I get great results. Okay. The mushu, this is like squeezing from the side to lift. Okay, like when you squeeze the toothpaste in a tube, you're coming from the sides and elongating. And then at the top, you either use stomach 9 or UB2, or I have a point later you'll see under the teeth. But it's you're trying to coordinate the 3 dantians to give space for 3 dantians. Don't worry if you didn't get this fully yet. This is a big concept. Okay. So that's this one. And then you have another which sounds the same, but it's actually very, very different. This one here is the legs are not being used. This one that you're using the inner yin, you're not using the legs, so everything falls down. See, that's why in this picture, this person is thin, okay, because they don't have to be fat. This one, this is someone who's overweight. They have a huge belly and it all falls onto the inguinal floor, on the inguinal ligament. Okay, so they might have very large breasts, they may have a very large belly, or for some women, it's not that they're so big, but they've had a hysterectomy. Or they gave birth many times, so they've been pushing down for many, many times. Okay, 8 children to 10 children, something like that. When they do a hysterectomy, what happens is the space that used to be the uterus now is empty and all the organs fall down. That's why it's called visceroptosis. The organs are falling down. This one from before, this is not the organs falling down. This is the legs not supporting the space of the abdomen. This one is the organs are falling. Okay? So different treatment. Notice that inner yin comes in both. Okay, so the main point for this one is stomach 13 needled outwards towards lung 1, lung 2. Okay, then add to it gallbladder 26, add inner yin, which is on the kidney channel level with liver 9, and add the immune points. Why? Because immune is related to ligaments, and this is pressing on the ligaments. Okay. So talking about the inguinal ligament, what happens, this is not exactly a type, but this is important to check, especially when you see you're not getting results. Because what happens is the circulation into the abdomen comes from the legs. The abdomen is fed at the end. Okay, so what happens is you're checking the abdomen, nothing's moving, nothing's moving. Think about, oh, maybe they have a blockage in a liver 12, spleen 12 area. Okay, the area that I'm marked here is kidney, liver, spleen. Or maybe the inguinal itself is congested, so there's no good circulation. So if the inguinal is blocked, think of liver 4, an immune point. If the thigh, the upper thigh is blocked, figure out, is it kidney, is it liver, or is it spleen? If it's kidney, use kidney 7, it will probably release it. If it's liver, use liver 4. And if it's spleen, use spleen 9, it will probably release it. And then there's a good chance that the abdomen will start to respond because there's going to be more circulation coming into the abdomen. Okay. This is not something you see all the time, but it's worth knowing because when that happens, it's a big drag. You know, it really prevents you from doing things.
Again, the idea is to puncture those points or just to
You can, but you release. There's a reason why it says release with. So ideally you release with and it's gone.
Okay. Okay.
But sometimes, no. It's true. Sometimes, especially the thigh, you can needle them. Sometimes there's a lot of, it's a strong blockage. And even though you released it, the abdomen is still not moving. Yes, you can needle them. You certainly can needle them. It's totally fine. Okay, then we have another type. We call, it's the type that, you know, that they get dizzy, they have vision problems, the post-stroke people can be like that. We call basilar artery insufficiency. Okay, they will show on the cervicals, that the reflection zone of it. What you'll find in the body is the cervicals. These are people, sometimes they have to walk with their feet wide apart. Older people, they can't, if they walk with the feet kind of close together, they can't keep their balance. Okay, so the treatment for that is, the original treatment by Nagano was Sanjiao 8, liver 8, and kidney 10. I tend to do Sanjiao 8, kidney 7 or kidney 9. I don't do kidney 10 for this. And I use inner yin rather than liver 8, usually. On the back, the treatment is Ihikon. We saw that before. Bladder 60, 58, and 40. Okay, so you see that a fair amount, especially in the elderly. Some people will say, I can't turn my head to look back when I'm driving. You know, that's often a basilar artery insufficiency. Okay. The head injury type, okay, it can reflect on the SCM and it can reflect on the cervicals, because it will reflect more on the throat. Often, and also it may actually show on the opposite side of the injury. So if they injured on the back right side, you might actually find a weird spot on the front left side, kind of across from it. Okay, so if the injury now, since usually it's very hard to tell where the injury is, so actually use both treatments. You know, so don't worry so much about Shaoyang or Taiyang. Okay, but the Shaoyang to also their front and back treatments, so you have both. Okay, so the Shaoyang area we use Sanjiao 8, and for head injury we will use also gallbladder 40 area. Okay, if the pulse is rapid, use Sanjiao 5 and gallbladder 41. For the Taiyang area injury, this is your Ihikon again, bladder 60 needled upwards, bladder 58 just in, and bladder 40. And here's the thing, most people will take bladder 40 where bladder 39 officially is and needle it just straight in. I prefer what you would probably call bladder 38, so I take about an inch up from bladder 39. Okay, so the red dot and arrow, that's the lateral area of the thigh. Okay, and I needle it towards the popliteal fossa. So the popliteal fossa, there is a triangle above UB40. I go to the lateral edge of the triangle and I needle towards the triangle. That's my preference for bladder 40. I do have some substitutes for this combination. For example, instead of bladder 60, I might use gallbladder 39. It's quite common for me to do that. Sometimes instead of the bladder 40, I will use bladder 36 under the buttocks. Now, we talked about the kidney 3 brain point, that just above kidney 3, there may be a nodule. And do 4 on the spine or the watto. This is where the brain stem sort of, there's I'm not sure what it's called, but there's a spinal canal that goes from L2 all the way up to the spine. Okay, so you're trying, it's the do 4 is like a Jingwell point for the brain sort of thing, if that makes sense. Okay. Then we have people who've had a tailbone injury. They fell on the tailbone, they fell from a horse, they went skiing, whatever, something like that, skating, something like that. And because it can affect the whole spine and the whole nervous system, it's considered a type. And the treatment for the tailbone is any one of those 3 or all 3 together. And it can be both sides. It might be, you might need both sides for one point, one side for just one of the points. It's hard to know what the combination is going to be. But bladder 66, lung 8, and the wattos of C7T1. Okay. Then you have nose issues. Okay, and lots of people have nose issues, and that can be, it includes the allergies, but it includes also broken noses or deviated septums. Now, how do you know someone has a deviated septum if they didn't tell you? When they lie down, you're going to see it. You see this woman at the bottom here? You know, her left nostril is very narrow. Again, the right one is much wider. That's a deviated septum. Okay, so it's very easy. You don't have to ask them to look up because they're going to go on the table. You're going to see it. Okay.
I'm sorry, I lost about 10 seconds. Can you start from the beginning, from the start? For nose injuries? I'm sorry.
Okay. Yeah, no problem. So what I'm saying is deviated septums are going to show that one nostril is narrower than the other. It shows on the picture. You're probably not with the picture right now, so that's, but everybody else is seeing a picture. So her left nostril is much thinner, is narrower than the right one. That's a deviated septum. Okay. So because, we treat people lying down, so we see it immediately. We don't have to ask them to do anything weird. Okay. So the treatment for nose issues are the immune points around large intestine 11, but on the edge of the bone. Gallbladder 40 sometimes is a miracle point for nose, for especially stubborn nose issues, deep nose issues. Do 23, just like with TCM. Do 2, I'm putting here, this is really not quite it. What happens is some people get very stuffy when you put them face down. Do 2 is a good point to open their nose while they're face down. It's not really a great treatment point for the nose, okay, in my opinion. Now, the large intestine 20B tongue area, yes, you can needle it. It's okay. Generally, what I do, because I don't like needling the problem area, but I do use these points. I give them magnets. For example, people who snore, I give them magnets to put at night so that, their partner doesn't have to suffer from their snoring. And most people, some people say it helps very much. Most people say it helps for a few days, and then the nose gets used to it. So you have to kind of like stop for a while before you can do it again, for most people with snoring. Okay. The jaw, the TMJ, very, very important because it produces tension everywhere. Okay, and hopefully we'll have time to see that a little bit more practically. So it shows somewhere around stomach 6. It's a large area. And it can also show on the mastoid bone as well. And these kind of people will have headaches. They may have hearing problems. They'll get dizzy. All sorts of things can happen. Okay. The treatment for that, it's this adrenal treatment usually is kidney 9. Kidney 9 with kidney 27. Sanjiao 8, behind gallbladder 21. So take gallbladder 21, just go slightly behind it. That point behind gallbladder 21 and the jaw, they treat each other. Behind gallbladder 21 treats the jaw can treat behind gallbladder 21. And if you go to the center of the chin, that also treats TMJ. Okay, balances the musculature of the face. Okay, so now we're getting, yes, go ahead.
Just, so you talked about how it's stomach 6 area, but then the circle on the image is that stomach 7.
Yes, I know. Okay, no big deal.
Okay,
Yeah.
no big deal, but it's a different point.
I understand. Well, I said stomach 6 area, and it's a large area. So you have many different, see, this is the actual joint, because this is TMJ, but the jaw, okay, you have a bunch of different options here. You have a situation where the actual joint, which is what's circled here, okay, that's one thing. But the joint is usually out because of the muscles, and the masseter, which is is not attached there. It's the masseter that's usually the pulling one, okay? And that's the one right underneath that.
Mm-hmm.
Okay, and that ends up around stomach 6. Okay,
Understand.
so it's the TMJ, you have to go, okay, let me stop the share, for example, so you can see what I'm, okay. So TMJ, you go from the ear, 1, 2, 3, 4. It's a whole area. It's a big area, because anywhere, it can be purely muscular, or it can be a joint as well. The problem is TMJ, the J is a joint. But the problem is the joint is here, but the whole area is much bigger.
Mm-hmm.
Make sense?
It makes sense. There's different muscles. So do you do all of that area? Do you go into 7 and the...
No needle. I don't needle the area.
You don't needle the area.
I'm just palpating. I'm palpating.
Right. Oh, you needle the
I'm
treatment. I see.
it.
The treatment is lower. Yeah.
Yeah, the treatment has nothing to do with that.
The area. Yeah.
I mean, it has to do with the area, but I'm not needling into the area.
Got
If
it.
I'm going to do something locally here,
yeah,
I have what's called diode rings. I will put a diode ring on the most painful area. Tape a diode ring on. That's a different, but that, but as far as
You're
needling,
gonna put a what?
diode ring.
Oh.
Sorry. So it's one of my toys. So
okay.
All right, so that was the TMJ. Sorry. Okay, now here's a big concept. We touched on it quite a lot, but let's really get it, so there's absolute clarity here. If there is a fire point on any channel that is painful, when you press on it, it's painful, it suggests that you should use the metal and water points on that channel. Okay, why? Because water overcomes fire, and metal nourishes water to make it stronger, so it will overcome the fire. Okay, now, this is especially important on the kidney channel and the pericardium channel. It doesn't get dictated as much, okay, in the other channels, but definitely consider it, and also consider if you have pain on a certain channel, maybe the metal water points will release that pain on the channel. So it's also good for just channel pain. Now, there's a few exceptions. Okay, so first of all, the lung fire point, you take lung 10 on the bone. I take lung 10 behind large intestine 4. I take it on the fleshy part of the thinner eminence. Okay, so it's important because this lung 10 is not going to show a lot of pain, but this one will show a lot more, especially if you try it on people with bronchitis or asthma and stuff, you will find. So it's closer to pericardium 8 than you used to. My pericardium 8, by the way, is right in the center. I know there's a pericardium 8 that's between the index and the middle finger. I take it below the middle finger. Okay. For the heart, okay, we use, so for small intestine channel pain, I use heart 3, okay, instead of small intestine 1 and 2. And for heart, I don't use heart 8 and 9. I use small intestine 9, 10 for heart channel pain. Okay, so those are the two. The small intestine.
There's something I don't understand. You wouldn't use like heart 3 and heart 4?
No, that's what I'm saying. If I would use small intestine 9, I will not use the metal water. I will use small intestine 9, 10 instead. And the same thing with small intestine channel issues. I will probably use heart 3. I could use small intestine 1 and 2. That does happen. I do have that combination. But for the channel itself, if there's a channel pain on the small intestine channel, like the scapula or something, I will use heart 3, not small intestine 1 and 2. Small intestine 1 and 2 I use for digestive issues, not for channel issues. It's just how I do it. I can't quite explain. But so those are the two exceptions, clear exceptions to the fire point is painful, but I'm not using the metal water. And that's on the small intestine, on the fire element. I guess because it's the fire element. I don't really know. So, all right. So, since we're on fire, inflammation is a very big deal. So here are some anti-inflammatory points. Liver 5 is a great anti-inflammatory point for the lower jowl. Liver 5 is the low point. The lower channel goes into the genitals, into the lower jowl. But my liver 5 has to be on the bone, and it's often a little bit above, because liver 5 is 5 tsun, according to the book. It can be a little bit above, another tsun above or something. And I'm looking for a dent, a place where there's a dent in the bone. Okay. Spleen 5 is the great inflammatory point, also for the abdomen in general, not just the lower abdomen. And, maybe a little bit more digestive, but also for gynecology. Okay. So, for example, if somebody has PID, pelvic inflammatory disease, liver 5 and spleen 5. Stomach.
If someone has a what?
PID, pelvic inflammatory disorder. And then stomach 41 is an anti-inflammatory point. So what I do is so there's always an argument exactly where is stomach 41. I tend to think that stomach 41, I go from liver 4 and I go 1 tendon over, because there's 3 tendons there and they're not all that easy to distinguish in all people. I know that my location is not the textbook. The textbook says 1 more tendon. But this stomach 41, go from the gallbladder side, go one tendon over from the gallbladder side, and it gets needled towards gallbladder 40. That's the anti-inflammatory stomach 41. Regular stomach 41, I needle towards kidney 6, towards liver 4 or kidney 6. Okay, so just know that it's kind of same point name, ever so slightly different location by millimeters, but the main thing is the angle. Okay.
Avi, I'm so sorry. Would you mind puncturing those on you? I just want to see how you do it. You go under the tendon for the 41 anti-inflammatory towards 40.
Okay, hold on. Let me.
I'm just curious.
That's okay. Yeah, I just have to get the get something going to show you, right? Okay, so we're talking about stomach 41, right?
Yes, please.
Yeah. Okay. Let me get the needle. So, stomach 41, regular stomach 41. One tendon over from the liver side, one tendon over, and needled this way towards kidney 6. Oops, oh, the needle fell. It didn't want to take, sorry. And then, but the needle would go, can you see the guide tube?
Yeah.
Okay, this is the angle I'm looking for at stomach 41 for
Okay.
orthopedic issues. If I'm doing it for anti-inflammatory, I come from the gallbladder side, come over one tendon, so it's actually a slightly different location. They're very
Mhm.
close, and the angle this time is this way.
Mm-hmm.
Okay, so opposite angle.
Yeah, okay. I was just curious because when patients are lying down on their backside, that area tends to be very taut, very, so it's hard to go below.
Well, it's a lot. Actually, it's easier when they're lying down, face up, because at least they're not using the feet.
Yeah.
But sometimes you'll have to. Yeah, it's true. Some people can be very tight. It's a very interesting. I had a comment on that, but I won't say it. No, because I was going to say, because we have a fair amount of French Canadians that in my part of the world also, and the French Canadians seem to be a little tighter there. I don't know why, and I always think, is it because they think they're in Paris and they're walking on high heels, or I really never understood. So it might be, there are certain ethnic groups that have certain particular characteristics, but I don't know what it is. So it's possible, but sometimes, yes, if it's very tight, if it's hard to get in, just move the ankle. They don't have any weight on it, so they don't mind. So yes, it can happen that it's tight.
Yeah, thank you. Perfect.
All right. And honestly, I don't know enough about all French Canadians to say, oh, that's typical. But I've just noticed a few that are, and I'm like, wow, why is it? So, anyway, so we're back to this, and okay, we did this. And okay, so now we're talking about the detox in the skin that we talked about. So, if somebody has skin issues, that may put them in this category, not just as a symptom of skin, but that might be the main treatment for everything else that they have. That may treat their back pain even. It's very hard to know what it will treat. So this is for any skin issue or any detox, and you check it either against the thyroid as a reflex or against the liver as a reflex. Now, for eczema, itchy or oozy skin, or especially poison oak, the best treatment is liver 5. Direct moxa. It's a direct moxa point. There's really no space to put a needle in there. It's so close to the bone. It's on top of the bone. And then if they have boils, like skin problems that are boils, not just eczema oozing skin, but boils, that's considered UB63. And by the way, UB63 is also used for diarrhea. It's a spleen supporting point, for what in this style is called cockscrow diarrhea does not mean diarrhea at 4 o'clock in the morning. This kind of diarrhea is explosive. It makes the sound when the bowels move, it makes the sound like the cockscrow. Okay, like the chicken. Okay, so it explodes out. That kind of diarrhea. is you use UB63, the metal gate. It's because the colon is another metal gate. Okay, so yeah, that's the reasoning behind it. Okay.
I just have a quick question again, Avi.
Yes, please.
Can you explain explosive diarrhea one more time? No, I'm just kidding. I'm just kidding.
No, I can explain it. It's not a problem.
No, I was joking. I was totally joking.
I'm sorry. I just made a funny. Hold on a second, because I had to laugh this one and I didn't get the rest of your sentence. I said explanation instead of explosion, and you know.
Well, that's the thing. Well, but unfortunately, you asked me to explain explosive diarrhea.
I know it was a joke. It was totally a joke. Yeah, no, I want to.
It may not work in French anyway. So.
Yeah, exactly. Let's not go there. But oozing skin, is that, what would that be like an example of?
Skin? Oh, itchy skin, eczema, you know, any kind of skin problem.
And oozing. What's oozing?
So the basics. Okay, so what do we say about skin? Think about it this way. Skin, generally speaking, is the blood is not nourishing the skin, and what this is saying. So in TCM, they're going to say nourish the blood. But what really usually happens with skin is the blood quality isn't good. You're not getting enough nourishment into the skin. So there's some toxicity. So originally, kidney 9 and large intestine 15 was a skin treatment, nothing to do with detox. We haven't heard of detox yet when I first started. Then it became also a detox treatment. Okay, and you can see that it makes sense. When the blood doesn't have good enough quality, when there's some murkiness in the blood, the skin is going to be problematic. Okay, now then we're saying if you also have itchy, oozy, like you want to give it more of an oomph, this treatment, you may also need to use liver 5. You may also need to use UB63. But the basic that you start with kidney 9 and large intestine 15. And tomorrow you'll see the large intestine 15 in the context of large intestine 15, why it's a detox point. Kidney 9 is called the guest house. Kidney 9, everyone agrees, is the detox point. First of all, it detoxes the kidneys. It has to do with the kidneys. And it's the word guest house, Ju Bin, means to kick out the guests from your own house. Okay, kick out what's not wanted. Okay, large intestine 15 is a story we'll go into tomorrow. Okay.
Thank you. Yeah, thank you very much.
All right. So we're almost there. We're almost finished. So, okay. So
I will need a break in a few minutes.
Okay, why don't we take a 5-minute break now? Will that make sense?
Yes, that it does. Thank you.
That's 5 minutes good, or
5 minutes is good if you want to.
Okay,
Thank you.
Let's do 5 minutes. Everybody come back in 5 minutes. All right. Continue. So sharing the screen. Okay. So this is the last section where there's no really new information here. So I just want to give you ways to look at things. So I don't do a lot of pulse diagnosis, but some of the things that, these are things that when I take the pulse, I'm thinking, oh, what's going on? And maybe I'll use these points. So a pulse that's short, it doesn't feel all 3 positions, and it's weak, like there's no ch pulse. To you say no ch, you say kidney. I say it's a short, weak pulse, use spleen 6 and pericardium. Build up the blood with the spleen, okay? Then there's the pulse that it just moves up towards your finger and doesn't move forward. It just bumps up into you. It lacks the rolling quality. It lacks the slipperiness. Okay, we don't want the pulse to be totally slippery, but we want a little bit of it. And it's not a wiry or a tight pulse. It's a pulse that just does not have a wave. Okay, that's a lack of stomach chi, and those are the stomach chi, the bumps on the stomach channel between stomach 40 and stomach 41. A pulse that's weak and it doesn't have a middle position, no spleen position, that's more of a spleen 3 rather than spleen 6. A pulse that's flooding, big pulse, that's a Ren 4 or UB27 type pulse. A wiry pulse, okay, Wiry means it's that quality that you know is wiry, but it's not a weak pulse. It's a strong pulse. That's often people with brain issues will have, like Parkinson's patients might have. And that's gallbladder 39 and spleen 9 combination, and both of them are needled upwards towards the knee. And then you have the tight pulse, which is what TCM might like to say wiry, because the quality is similar. But it's a thin, it doesn't have to be weak, but when you press on it, it either disappears or it becomes soft. Okay, that's the pulse that I use under the third toe. Okay, so these are categories from pulses. Whoops, I keep forgetting. Okay, now here are some points. Now, this is stuff that you can take without using my techniques, without using palpation, just so that, you know, a whole bunch of points that if a person has these conditions, these points are probably most important for them. Not just, they're considered as types for me. In other words, say liver 5 for endometriosis or anti-inflammatory. Somebody who no longer has endometriosis because they removed everything, they scraped everything, but suddenly they have back pain. There's a good chance that liver 5 will solve their back pain. Okay, so don't use them just for the symptoms, also use them for someone who has those things and use them as a elementary point for that person, as like a constitutional, so to speak, point. Okay. So liver 5 is an anti-inflammatory point and used for endometriosis. Liver 8, anybody who has cyst, you most likely have to use liver 8. Spleen 7, anybody with water retention, edema, and for bleeding. Spleen 9, needle upwards towards the knee, is the appendix type. Kidney 9, if somebody has inguinal tension, pain on the inguinal, that's not from visceroptosis, not because they have a huge abdomen, that's different. Or if they have a jaw problem, or for detox issues, that's the kidney 9 category type person. Chances are you'll use kidney 9. Somebody has bone pain, bone problems, ovarian problems, or they have kidney 2 pressure pain, chances are you'll be using kidney 7. Okay. Someone who has that pulse, we talked about that before, that only rises and falls, doesn't have a rolling quality forward, that's a stomach chi points, the bumps on the stomach channel. The wiry pulse is gallbladder 39 needled upwards. Scoliosis is also gallbladder 39 type. Hormonal types, UB66. Blood pressure types and autonomic nervous system type under the third toe. However, don't use that for slow pulse unless the pulse is very clear to you that it is what we call the name now escapes me, not wiry, tight pulse. I had to look the word up, I'm sorry. All right, so those are those types. Autoimmune disorders and cardiac patients, Ren 4. Again, not for slow pulse, so use the Mushu instead, the one on the side. Rapid pulse with autonomic nervous system issues, use Ren 6. Use Ren 12 for any neurological condition, as well as for the spine. Use DO 2 for autonomic nervous system disorders and for the spine. The immune point used for immune and lymph, like it shows on Sanjo 16, used for the people who have nasal issues their whole lives. Use if you have Ren 12 pressure pain, or for people who have temporal headaches. So remember, don't just use it for these symptoms. Start thinking, oh, the immune point is very important. It may be the point that releases everything else for that person. It's a type. We're now not talking about the symptoms. I'm listing symptoms, but they're becoming a type. Okay, Sanjo 8 and Sanjo 5, they're for the tight SCM, the person who has a tight SCM, and the cervicals are tight also, the pain on the cervicals. The difference is Sanjo 5 tends to do a better job for rapid pulse. Okay, pericardium points, So again, choose according to whether there is pressure pain on pericardium 8. Okay, use 3 and 5 if there's pressure pain on pericardium 8. Use 4 or 6 if there's no pressure pain on pericardium 8. And for any blood disorders, use pericardium with the spleen. Spleen points plus pericardium. And for insomnia and for emotional issues, use the pericardium. Okay, so we are just about done. I want to give you some sort of flow chart on how do I start. So I took the medical history. I now palpated the body. I know what my palpatory findings are. Now, the third step was to prioritize, to create a story. That's what I'm trying to do now, to create a story so I can test if that diagnosis is correct, if it's going to solve the problem. So how do I start? The first thing is I'm looking at the pulse. Is there a certain pulse that calls? And is there any restricted circulation, meaning low blood pressure, the weak pulse, or lack of stomach chi? All these suggest that the chi and the blood are not moving. I have to treat that first because otherwise nothing else is going to work. Doesn't matter that I have the greatest strategy on the planet. If the chi and blood are too slow moving, okay, the strategy is not, I'm not going to be able to implement my strategy until the chi and blood are moving. Okay, so that's an important thing to address. Okay, next.
Hold on, Javi. I have a
Yes,
little
yes.
technical issue. I'll come back in 5 seconds, maybe.
Oh, yes. Okay, we're waiting.
If you start talking, is it working?
If I start talking,
Okay, go ahead. It's
good.
fixed. Go
it's
ahead.
fixed. Okay, so are we good with this slide? Was this okay? Do we have to repeat this?
No, we don't. It's okay. Thank you.
Okay, so we did that one. Then you're actually checking circulation that's blocked, either in the blood flow, lymph flow, or nerve flow. So the tight SCM is a nerve flow. The vagus nerve controls most of your organs, not the diaphragm or the lung, but it controls most of your digestive organs. Are the cervicals congested? That controls the diaphragm, C4. Do you have inguinal tightness? That means the circulation, or the inner thigh tightness. That means circulation, blood circulation into the abdomen is not good. Release those blockages, okay, first, so that the brain and the organs can communicate and the circulation from the legs into the abdomen happens. Okay, so that's something, these are things that can block your treatments from taking place if you don't release those. Then you say to yourself, now what does the abdomen show? Okay, does the person have adrenal? Does he have immune? Do they have autonomic nervous system, either from the SCM or from the pulse? Do they have a Ren9 pulse? Do they have an endocrine problem? Like the stomach 28, ovary, or kidney 13, the uterus? Is there a sugar, a thyroid, or estrogen problem in the medical history? These are all primary types because they affect everything else. So you have to treat them first, or at least consider treating them first. Okay, so those things come first. Then you say there are metabolic systems, like diabetes, autoimmune, or cardiac. Again, the whole body is affected by these. So you have to address these first. So there's a whole bunch of things that take priority just because of the name of the disorder, because it's a disorder that affects everything. Okay. Then after you've done all of that, you say to yourself, what else? What is unresolved now, either in the abdomen, the neck, or in the symptom? Let's say they came for knee pain. How much of the knee pain is still there? Now you can address the actual knee. Now you can address other things in the history that don't seem to be very central, or a symptom that you need to address. So first, deal with the circulation, with blockages of circulation of either nerve or blood circulation. Then do your major types, the adrenal, the immune, the autonomic nervous system, the Ren9, the sugar, thyroid, estrogen types, the diabetes, the autoimmune, and the cardiacs. Once you've done this, now you can address whatever you need to in the symptoms. Does that make sense? And that's it for this part. So,
Oh, it doesn't mean it's over yet.
no,
For
I
the,
didn't.
for the day. Okay.
No, it is not.
Okay.
It is not over. I'm well aware. So this is what I wanted to. We have 30 minutes, and here is what I'd like to ask. Sorry, 1 second. So we have. I have a whole other thing, but it takes longer than half an hour. So we have a few options on how to do this. Is everybody because we could finish that extra slide, this extra thing tomorrow. I believe everybody's here tomorrow. I originally thought it was 2 different classes, but it sounds like it's really 1 class. Is this correct, that it's 1 class? I see a yes from Sophie. Is this, can somebody confirm? It's 1 class. Anybody here not coming tomorrow? Okay. So my suggestion is let's take the first 20 minutes so we can leave 10 minutes for questions at the end and start on this whole new phenomenon. Okay? So, any questions before we move on?
Yes, I have a question.
Yes.
Hi again. So we talked about, points and different energetic types or different archetypes of people, etc. Do you also talk about lifestyle, food choices, patterns like that? Because I know that the needles are not just magical, and if the person keeps eating sugar and sweet food and all this kind of stuff, their system won't necessarily change as well as, so what are the, where do you get your recommendations? What do you look at as the homework for your patients?
Fair enough. So, the moment you say homework for the patient, that you're in trouble because did you do your homework when you went to school? Do you do your homework as a patient?
Always.
I'm very glad. That's very nice of you, but I didn't. And by the way, this is one of the reasons why I'm not big on herbs, because if you give people herbs, you can't tell if they'll take it or not. Acupuncture, at least they made the appointment. At least I did everything I could. So yes, I talk about lifestyle and I try and be as gentle as I can with it. And I try and give them the most, to negotiate the easiest possibilities and the least amount of guilt tripping. But it doesn't, no matter how gentle you are and how easy the advice is, I can't tell you how many people have told me, oh, I can't eat that. I can't eat that. And now I'm the kind of person, I can eat the same damn thing every day. It doesn't bother me at all. Some people have it, I can't eat it. I ate that yesterday. It's like, it's impossible for them to eat it. So there's I do what I can, but I also have to admit that it doesn't work well. If you're a lifestyle consultant, you're in a very difficult field, or a nutritionist. It's just very, very difficult. So I do what I can. I give people as much advice as I can. And I'm just very aware that they'll do in one ear, out the other, or in one ear and sort of regretting afterwards that they just can't do it. Yes, of course, eating sugar is not good for you. Yes. But it's the reality of our lives. And listen, there are all sorts of things that I think are not good for you that you might think are perfectly good for you. But so it's impossible. And also there's no one diet. That's the other problem with diet problems, because, it's like, is it keto or is it no sugar, or is it this or is it that? Or, look at how many dietary books there are, and they all claim that they're the best. Clearly, they work really good for some people and don't work as well for others. So people have to find out. I really encourage people to find out what works for you, do some research. I will give you advice, but I know very well that, you know, number one, you won't keep everything I suggest, because even I don't keep what I suggest. How could they? You know, and I mean, we all, you know, freak out and eat ice cream and do weird things. You know, it's just the nature of it. But yeah, a certain amount of exercise, a certain amount of relaxation, a certain amount of purpose, and a certain amount of dietary integrity are very important for people. But if I had to, like, I mean, because then I have to be someone's nanny, you know, I have to be with them 24/7, you know, then I can't treat anybody else. So I have to open a retreat center, you know. So given our conditions as acupuncturists, I have chosen not to get too deeply into all the lifestyle issues so I can do acupuncture. And I have to let go. I will give them what I can, but I'm not going to make that the central point unless it's something so glaring, you know, like, oh, well, listen, your liver is screaming and you have hepatitis and you're still drinking. Yeah, well, you know, don't bother coming to me. I mean, I don't want to waste your time on your money. You know, just send me the check. Don't even come. Just send the check. It's fine. So some things, yes, are really obvious. Sometimes I will say things to people like, you know, you know, I'm manipulative, okay, like everybody else. I'm on the back and I'm going, wow, you have puffiness around your sugar points, T11, T12. You know, it's very typical of people with sugar problems. Maybe you should think of reducing that. I push a little, you know, like, the doctor found something interesting and it must mean something. But as a whole, I try and give the lecture once and try not to discuss it again unless they bring it up, because it's just too much effort on my part and too much frustration on their part. So does that answer the question at all?
Yeah, partly. And then I'm just curious, like, you know, how much acupuncture will help something if the person doesn't change their lifestyle.
You never know. You do the best you can. And look, you're one of the causes and conditions in the world. You're not all of them. So it's very arrogant for me to say, if I do this, this will happen. So I contribute what I can, which is, by the way, one of the reasons why I like to give people exercises, like physical exercises, poses, or something like that, or mental exercises, not so much with the food. Because they're much more interested in, oh, if I do bridge pose or if I do this, it will help my back. They're a little bit more willing to do that. It's more interesting for them than to do, you know, a dietary change. Diet is one of the hardest things to change in people. It's easier to change the time you wake up in the morning than your diet. So that says something, right? So, all right.
Thank you. Thanks so much.
Anyone else? No. All right. So let's. Oh, Carl. Yes. No.
Yes. Yes.
Oui,
Oh, no. You just showed up again.
Oh, yeah. No, I'm fine. I'm good.
You
Thank
don't
you.
have another question.
Yeah, no.
Okay. And Lisa Lacroix question? No. Okay.
oui,
Oh, oui.
oui. Oui.
She says, when we're palpating the liver region under the ribs and the liver is hard, what does it mean for you?
If you can actually feel the liver is hard. I mean, if you're feeling a hard tissue under there, it means the liver is pushing against the diaphragm, and it's probably it's probably the excess, the physical liver damage. You're looking like you're not sure what's going on.
Non, c'est que je me dis à ce moment-là,
She was wondering if the liver is like this, how do we treat it? How do we treat it?
Kidney 7, spleen 7, heart 3, pericardium 4 on the right side. That's probably the right treatment.
Repeat the sequence. Repeat the sequence.
Right side, kidney 7, spleen 7,
okay,
heart 3, pericardium 4. Exactly.
Okay. Merci.
She
You're
said
welcome.
okay and thank you.
You're welcome too. And anyone else? All right, let's move to our next subject. Okay, so we have lots of styles of acupuncture, and this is just one style. Okay, so you have all sorts of options out there to choose from. And obviously, I gave you a whole bunch of points, and some of you will experiment with those points and you'll use them, but often you won't, because you're used to your style. Okay, so, and one of the things I'm saying is, well, my style is all about testing, but I want to give you a whole other point of view on acupuncture that has nothing to do with what style. I will incorporate my style into it, but I want to suggest that sometimes we're going the wrong path when we do acupuncture. We're too obsessed with 5 elements, with the organs. Okay, so like I told you, I'm always interested in finding the root. Okay, I'm not going to repeat all these slides because they're the same as we did before and we don't have time to do this, but I do want to go through this slide. Why do you choose a point? Okay, because it's part of the protocol for the finding or for the medical history, or sometimes it's just my teacher said that, so I trust it. I did not invent kidney 7, spleen 7, heart 3, pericardium 4, but my teacher's teacher said that, and it works for me, so I use it. Sometimes I choose a point because of the location or the channel, or the classification of the point or whatever, and it fits the strategy. And sometimes I choose a point because of the name reminds me of something, which is a whole other phenomenon. And that's unfortunately for most of us in the West, because we originally learned the points by numbers, it's not meaningful for us. So you really have to make a big effort to start learning point names and see which points have which names in different places. But that's a different story, a whole different ballgame. Now, the big thing is that a point has to actually prove itself by making a clear change. And you can make the change, if you can see it in the pulse, that's great, in the palpatory findings in the abdomen, or whatever you choose, however you choose to evaluate it. And you want to do it before you needle, because why waste a needle if it's not going to do something? So it's really important that you try and evaluate the point you want to use. And it's not enough. So if I say kidney 6 is supposed to clear the immune reflex below kidney 16. If kidney 6 clears that reflex, big deal. It's supposed to clear that reflex. It's not enough that a point clears a finding in the abdomen, especially a finding that's related to it. The big deal is how much can I milk out of kidney 6? If I want to use kidney 6, what is it going to do? Is it going to release lots of things or just one thing? If it releases one thing, maybe I'll use it because it's the only way to clear that thing. But what I'm really after is a point that clears lots of things. The more findings a point clears in the abdomen and the neck or the back, the more powerful that point is for that particular person. It means that point is really central, really important for that person. It's like that person is kidney 6 type or small intestine 17 type, whatever point you use on that person. And you're going, wow, this is an amazing point for him or her. That becomes that person's point. Okay, the type, even though it doesn't exist in the text. Okay, so that's very important. Now, normally what we do is we diagnose and we decide which organ is the problem, what channel is the problem, and therefore what points to use. And that's very typical, okay, of just about any system of acupuncture, with the exception to some extent of the balance method, where they're doing more channel stuff, but they're still on the channel regardless. Okay, so we can include them in here also. I'm going to suggest that there is something more important than that. Okay, before you get to the organs, there is a very important thing that we need to do. And these are those 7 things You have to do these 7 things first before you do anything else. And even if you never touch an organ, you never diagnose an organ, but you do these things, it will help. It will be very important. So releasing the neck is obvious because of the connection of the neck and the nervous system and the brain and the body. Okay, it's very important. Shuai means, is there activity in the leg? Are the legs supporting the torso? It's the basis of being able to create the space in the abdomen, the lift of the perineal floor, which means now you have space for the organs. Without that, you don't have space for the organs. What is the state of the diaphragm? If the diaphragm is tight, there's not going to be good circulation and good elasticity anywhere else in the body. There's not going to be good oxygenation of the rest of the body. Is the spine free? The spine needs to have some movement to it because it controls the nervous system, and all the shoe points are basically off the spine. All the movement of the body is related to the spine. Shu is movement, to transport. And is the circulation open? In other words, I'm looking really just at the lung and the heart, so that area between the shoulder blades. And finally, can I relax the brain? If I can achieve all of these things, then I've created the space for acupuncture to actually work. Okay, so we're going to look at how do I accomplish these things one by one with acupuncture. So first of all, I'm going to suggest to you that the human body, the human organism, is, as they say, resides between heaven and earth. Between heaven and earth is the person, is the human, which means the human modulates yin and yang. Okay? Now, the 5 elements are just an expression of yin-yang. They are not a separate thing. It's not called 5 elements. It's called 5 processes or 5 walkings. Okay, wuxing, but it's not even called that. It's called yin-yang wuxing. The 5 processes, the 5 movements of the yin-yang. Okay, so it's important to understand that I have to establish the upright posture for the human being, the connection between heaven and earth. That's extremely important, first and foremost. Okay, and that's what this whole section is really about. And that has nothing to do with my style or any style. Okay, but I'll show you how I do it in my style. Okay, and it's highly correlated. The upright posture is highly correlated with the 3 dantians. And each dantian has a diaphragm underneath it. So the lower dantian has the perineal diaphragm. The middle dantian, the chest, has the diaphragm, the chest diaphragm underneath it. And the head diaphragm, the upper dantian, okay, the brain, has the vocal cord diaphragm, the laryngeal diaphragm underneath it. So the 3 diaphragms, or the 3 dantians, are a very important concept. And the way the Chinese thought about it is you're steaming the essences upwards. The steam move upwards. Or the yogis will say the kundalini moves, or something like that. Okay, so let's look at releasing the neck. Okay, it's important. This is the laryngeal diaphragm. We're starting from the top, although you will need, this is just for presentation, you will probably, what happens if their perineal diaphragm is totally collapsed, if they're not using their legs, the person's going to have a lot of tension in the neck in order to try and hold themselves up. That's just normal. So actually, you will probably need to start with the legs. However, I'm presenting it from the top. Okay? So it's important because it's the bridge between the brain and the body. And as we talked a lot about, the SCM can congest the vagus nerve. The scalenes are a breathing muscle, so it affects the lungs and the chest. And then you have C3, C4, C5, that's the phrenic nerve. And also people who have jaw problems also will have tightness in the neck and the throat. So that's another thing to consider. So releasing this area is very important to create what we call in acupuncture, what are we trying to do? Create smooth flow, create harmonious flow. That's the whole point of what we're trying to do. Okay, so just looking at the names of the points in the neck, okay, you can see that there are all these so-called chimneys, okay, which is really not a chimney. It's something that abruptly dashes outwards. It's like a dog that runs out of the cave, okay? So therefore, like a chimney, like the smoke shooting out of the chimney. But this chimney can go up or down. And what we have is we have a lot of heaven, the communication with heaven, and we have windows. We have 2 windows here, okay? And so we have this idea of the throat being, the throat for most people is narrower than the brain, than the head, and certainly narrower than your torso. So it's a place where things can get congested very easily. Okay, so very, very important to release the neck, the throat. Okay, now on the occiput, on the back, you have point names that have a lot of wind. Okay, so you have wind. What does wind mean? It means movement. They're saying that if any meditator knows that if you want to calm the brain, you have to tuck the chin in slightly so the occiput is opened. The neck needs to be slightly open and elongated. Okay, now look at this guy. This is from Star Trek. Okay, this is the Kardashians. Well, they're not the family in LA. They're the Star Trek Kardashians. Okay, whatever the difference in the pronunciation is. Now look at his neck. These are the Nazis of the 24th century. They're supposed to be angry people. Okay, now it doesn't matter. Don't look at the face. And let me do even this. Now, the face looks so cute, but you look at the neck and you're saying he's an angry fucker. It's very obvious. Why? Because look at the SCM. Okay, whoever designed these costumes was a brilliant person. I actually met them once in LA when I was teaching. It was very, very funny. But anyway, the point is the neck modulates the nervous system. Okay, so it's extremely important to treat. And I don't care how you treat it. I mean, I do care because I have a style, but it's important that you address it. I don't care if you do massage. I don't care if you use weird points that I've never heard of, but you need to release the neck in order to release the nervous system. It's extremely, extremely important. Okay. Now, let me talk about my style. If they have problems in the neck, in the laryngeal diaphragm, there's a chance that the pulse is going to have a tight quality, and they're going to have all sorts of interesting symptoms from the neck, shoulder, and arm pain, as well as digestive disorders because of the organs, as well as neurological disorders. People with stroke or head injury will have tight SCMs, tight necks. And with men, urogenital problems are going to show on the throat because male urogenital problems, both sexual and bladder, are highly correlated to the nervous system. Okay, so these are the points that we release the neck. We already talked about them all. Sanjiao 8 is like the big one. The neck, the throat especially belongs in the kidney. So therefore kidney points. Inner yin is an extremely important point. We originally called it releasing trapezius point. Either spleen 3 if they have scalenes, or spleen 9 possibly also. And bladder 2 primarily to release the occiput, but also the levator scapula. Okay, so very important to release the neck. Now, spleen 3, I just want to show you that this is connected to the upright posture. Spleen 3 is called the Great White. Okay, Bai is white, and the character comes from, it's the sun. And that dot says the sun is just rising. It's like dawn. At dawn, the dawn time, everything looks white. Okay, but the sun is rising. So rising from the ground upwards. Okay, so this concept of rising from the ground upwards is extremely, extremely important. We'll see that. And I guess we're going to see that tomorrow. We will continue from here.
Can you come back to the previous slide just for 5 seconds?
Yes, please, here.
Yeah, thank you.
All right. So, any questions before we end today?
Yeah, I have another one as per usual.
Yes, it's okay.
Full of questions. Can you go back to that slide, the previous slide, and you talked about how UB2 releases levator scapula,
Yes.
inner yin releasing the groins. Is that it?
Inner yin, no, inner yin, no.
Can
Okay.
you just go through the list of what each point releases again, please?
Okay. Sanjiao
Thank
8
you.
releases, okay, Sanjiao 8 or 5 releases the SCM and also releases the cervicals.
Okay.
Kidney 7 or 9 releases the SCM, it's also, and releases the cervicals also. The throat, the whole neck is in the domain of kidney. Inner yin, here's a little bit of an issue here. Inner yin releases the trapezius, but inner yin also establishes the perineal floor. If you can establish the perineal floor, the neck can relax. Okay. Spleen 3 relaxes muscles in general, but specifically, especially the scalenes. And bladder 2 releases, number 1, it releases the occiput. Number 2, it releases the levator. It releases more like the small intestine channel, part of the neck. Small intestine 13, the levator scapula type thing. Does that answer the question?
Yeah, very much so. Thank you again.
So actually, since we're here, let me stop the share. I want to do one exercise. We did not do a lot of exercises today, so I do want to do an exercise so that, we just have a few seconds left. But put your tongue, relax your jaw, really relax your jaw, and then let the lower jaw, the lower teeth drop down. Open your mouth, but don't open your mouth and bring the teeth back towards your neck. Open the jaw and let the teeth drop down, maybe even go slightly forward. And put your tongue on the base of the lower teeth. That's not Chinese. Okay. Put the tongue, the tip of the tongue, on the back of your lower teeth. And just relax everything. And just go, but not as loud as I'm making it. Very slightly, just allow the air to slowly come through the throat and out, and releasing the jaw. Allowing the jaw to drop more. And what do you feel in the rest of your body as you do that? Allow yourself to open the jaw. Remember, I can see some of you. Open the mouth. Free the jaw and free the neck. What happens to the rest of your body? Anybody has anything to comment on this? When you do, we call this the whispering ah. Ah.
Yeah, I definitely feel like at the end of the exhale, when
Yes.
it feels like my lower belly and my pelvis are coming in and up more.
Very nice. Good. Okay. So you see a connection between the two diaphragms. We activated the laryngeal diaphragm and it affects the perineal diaphragm, number 1. And number 2, hopefully some of you felt it creates a certain sense of like openness, a hollowness in the whole body. Ah. And that if you're not don't use the diaphragm, you just allow the throat. Ah. Like you're tasting very nice wine and you're just tasting to say, oh, yes, we'll have that Bordeaux from 1973, squishing it, and it's all very, that sense, and it creates a space in the body, okay? And that, just to start to feel the space in the body, the capacity of hollowing the body, not making it empty, hollowing it so there's space in the body. Just want you to start experimenting, okay? And we will continue. Anyone else with a comment or a question up to now? No. Okay, so Before we end, I just wanted to, to acknowledge Claude, because it is an extremely difficult thing to do, to talk for. I can talk, no problem. I'm just I'm just saying whatever is in my brain. I just spit it out, but he has to listen to me and then actually translates for real. So it's a real job. What I do is nothing. So, so just to acknowledge.
So thank you for the acknowledgement. People love you so much up here, so it's great. It's great.
Good.
So do I.
And I will see you tomorrow at 8 o'clock. If you have any questions, we can easily start with questions tomorrow. If you have any, just come out with them right away, and we will answer them. All right. So thank you so much. And I will see you tomorrow.
Thank you, Avi.
Thank you.